Thanks, Debbie. Thanks so much for the invitation to be here. I'd like to acknowledge that we are meeting on beautiful Aboriginal land, and I pay my respects to elders past, present and emerging. I also have to actually thank Healthway for really my career. Crunch and Sip was my PhD in New South Wales, and so it was looking at how do we get this implemented and scaled across New South Wales. And so if it wasn't for your incredible work and your incredible program, I'm pretty sure I wouldn't be standing here. I would not have studied implementation science, that's for sure. Thank you so much. And I guess it was really through the implementation. So my role in the health service is to see the implementation and scale up of healthy eating and physical activity programs in schools. And in the last 25 years in that role, I have seen many programs come and go, and it really, broke my heart. And so that's what really forced me to look at sustainment from a research perspective, but really as a health service role. And because I'm sure, like me, you have had many programs that you have seen come and go and that just pop. And so what I want you to do is take a moment, have a think about what those programs are, the ones that broke your heart when funding stopped. And I want you to have a think about why it stopped, because we're going to focus on that in a little bit. Okay, so to make sure we're all on the same page, what do we mean by sustainability? So there are words that are thrown around: maintenance, continuity, institutionalisation. But it's this definition by Moore and colleagues that I particularly like, because they looked at 24 different definitions or constructs, and they said that, hey, if we're all going to talk about sustainability, we all need to be on the same page. So make sure you define the length of time you're talking about. Are you talking about 2 years, 5 years, 10 years? Are you talking about the ongoing delivery of the program or the benefits? And what I particularly like about the Moore definition is that it acknowledges that things may need to adapt or change given the context we're working in. And so that really aligns with David Chambers and colleagues' dynamic sustainability framework that acknowledges that we are living in, the context, and so programs might need to change. But for the purpose of today, I'm really focusing on sustainment, which is the continuation of a program. And so I think this is our first Slido. Is that right, Tippy? The question is, what proportion of programs do you think are sustained 2 years after active implementation support ends? Anywhere ranging between 0% to maybe 50% we've got up there. I'll give people a moment to answer that.
All of you last time, about 36.
Okay, we'll give it a few more seconds. Okay, gold star. But anyone who said 20%, some people are a little bit more pessimistic or optimistic. So we know from systematic reviews that only around 20% of programs are sustained after 2 years of active implementation support ending. And so it's a problem, because we are wasting, as health promotion or health service people, we are wasting billions of dollars designing, implementing and scaling these initiatives, only to see them fall over as soon as we walk away. The other concern is that we risk really damaging the trust with our communities, particularly some of our vulnerable communities. It can take a long time to build this trust. We're going in, hey, we're here to help you, and then we're gone. And so the next time we come knocking, they're going to say, well, I'm not going to trust you because you kind of scooted out the back door last time and, there was no one here. But as a health service or as a public health practitioner, this is a slide that always breaks my heart, because we know that to affect change, that these programs need to be implemented to a sufficient level and then held there if we're going to see public health impact. We know that the behaviours we're trying to change are really, really complex. If we think about trying to change someone's smoking behaviour, it might take years, if not decades, generations, for people to be exposed to these programs. And so if we stop short, we're never going to see the public health benefit of these. And so why programs not sustained? So thinking about the program that I'm sure that was dear to your heart that you had to let go of? This is just an open response. Is that right? This is just an open response. I just want people to pop up their words. You can use, you can answer lots of times. Why did programs stop? Well, why did your program stop? Don't be shy. Anyone want to just yell something out? Oh, beautiful. Oh, love it. So yes, this word will, and Tevi, can we keep this? Because this is, yeah, love it. Okay, so yes, we're seeing things there. These are what we typically see. So there's been a number of systematic reviews in clinical and community settings that are looking at the determinants of why programs fall over. And so that all resonates. Funding, changing in political cycles, staff turnover. That's not necessarily aligned with the organisation. Lack of resourcing, other priorities come in. And so this is exactly, the challenges that, we're facing. We face all the time of how do we overcome all of these if we want our program to sustain. Oh, sorry, Cheppy, can I move on? Thank you. But despite all those barriers, there are examples of programs that do sustain. So I'm just focusing on schools, but there are examples in other clinical and community settings of initiatives that we know have sustained. And some of them continue without any support. And this is a term that we're calling self-sustaining initiatives, that they will kind of stand once you walk away. Or maybe these programs do continue, and what we're trying to, or do need support, what we're trying to identify, well, what are the most effective and cost-effective strategies to support them, rather than maybe intensive ongoing implementation support. And so what I'm just going to quickly talk about is one self-sustaining initiative that we have been focusing on in schools, which is around school uniforms. And so for those of you who work in school-based physical activity initiative, this won't be, you will know this story, that most of the effective initiatives are really complex, they're costly, they require oftentimes the teachers. And so these kinds of programs, while they might be really effective, they're really hard for policymakers and practitioners to not only scale, but sustain without significant ongoing investment. And so we knew as a health service that we needed simple, scalable, low-cost innovations. And we needed something that was particularly going to address girls' physical activity, because we're seeing girls' physical activity drop off from the age of 8 and it never catch up. And so girls had been saying to us, well, our uniforms are holding us back. And is there any wonder? This is me, circa 1983, and this is my daughter 40 years later. And apart from probably the faux pas with my socks there, our uniforms are pretty much identical. But girls are different. Girls are different from 40 years ago. So why are we still sending our girls to school dressed like that and expecting them to be active? And so we looked at, could we simply change all students' physical activity by just simply changing their school uniform? Now, in New South Wales, at least, and in other states that we've collaborated with, most often primary schools have two uniforms. They have a traditional uniform, which could look something like that, or what I was wearing before, and then a sports uniform that children are allowed to wear on sports day, which might be one day of the week. And so we said, well, this is already a policy. They've already got a uniform policy. We're not doing anything different. What if we just got the schools to allow students to wear their sports uniform on more days of the week? Ideally every day, but we won't go too crazy, even if we just increased it by a day or two. And so it was simple. We didn't have to do anything different. Schools already had these uniforms. There was no extra cost. In fact, we think there's a cost savings to parents of around $300 a year if they just move to a sports uniform. It aligns with school policy. We surveyed thousands of students, parents and teachers, and it was acceptable. The tricky bunch were the principals, so we've still got to convince them that wearing sports and shorts and a t-shirt is formal enough. And we saw improvements in students' physical activity, particularly girls, because what we were hearing was girls saying, I can spin around the monkeys bars now and not need to worry about my knickers showing. The effects weren't massive. but they were also almost on par with what we're seeing from some complex physical activity school innovations that, you know, require a lot of ongoing support. And so we know that once a school changes this policy, it becomes self-sustaining. And so we are seeing the effects, well, physical activity effects on par with other complex innovations simply by changing uniforms, and we can walk away from that. And so the take-home messages is plan for sustainment from the outset. Who is going to own your initiative when you walk away? If it's you forever, then great, you might go down what we're calling a supported sustainment path. But if you know that in a year or two you're not going to be there, who's going to own it? And if you can't think of anyone who's going to own it, you might need to think of the self-sustaining approach. Simple, low cost, acceptable, and ideally you're monitoring the implementation of this innovation, because if it dips, then you know that maybe we need to go back in to boost implementation. We have developed a guide, if people are interested, that will walk you through the process of selecting sustainment strategies. We're about to update it in the next year or two. It's a little bit, I think it's probably a little bit over the top, but that is there. And if people would like more information about our work, our research on sustainability or uniforms, it's on our website. So thank you.
Thanks, Nicole. That's fantastic. I really love the simplicity of it, and you're right. The sustainability is built in. It's a policy terms, and that's something it's very keen on as well, with the policy for sustainability. But I did want to draw attention to what you said earlier about dynamic sustainability, which is fantastic, because most health promotion programs can't be just set and forget. You do need to keep reacting, updating, and changing and programs to reflect change. Fantastic point. Right, thank you. Our next speakers are Professor Lenny Bartlett from Edith Cowan University and Ms. Caroline Ince from Playgroup WA. They'll present on the Healthway funded Playful Health Arts project and explore how arts-based play can be sustained and scaled across.
Thank you very much. Oh,
yeah. I wonder if everyone's taking that mistake.
It's just lagging a little bit.
And I have to go back. Okay, I'm starting here. Hello, I'm Lenny Bartlett from Edith Cowan University, and I'm presenting on behalf of our project team, and Caroline Ince from Playgroup WA is here with me as well. We'd like to talk about the project that we're still doing and nearly coming to fruition. But before we do, we'd also like to acknowledge the land on which we meet today, the land of the Whadjuk Noongar people, and pay our respects to elders past, present. And this actually underpins our whole thinking about our project. This is a great painting by a friend of ours called Rosie Payne, called Community Connections, and we'll tell you why that makes sense to us. It's just sorry. Okay, here we go. Right, so we really like the topic of what happens when the funding stops, and I think you'll hear this message time again today. It's not about when funding stops, actually. You need to think about sustainability before the funding starts. So this was very much in our mind, because being an old campaigner, like many people here perhaps, or young campaigners, this is something you have to think about. All your work comes to nothing much after a while, and that can be soul destroying for people that spend a long time putting projects together. So we had a clear community focus, and I'd like to thank David Zarb from Playgroup, and Mrs. Christine Lovering from Edith Cowan University. She's an early childhood arts advocate. So what we did when we built this project and we thought about how this might look is we want it to be co-construction. And that's a really easy thing to say. And anyone who sat around the project table will tell you it's very hard to deliver. So in co-construction, when we first were thinking about this project of bringing arts play experiences to play groups, we made sure that the people around the table could all add something and were a stakeholder within the community. So around our table, when we thought about this project, we had many communities to represent. We wanted the health promotion community to be there. We wanted the communities in which families were embedded to be present, health communities, early childhood, academic communities, arts communities, and so the community list went on. So the people that sat around our table were selected carefully. For example, we had a member of the Community Arts Network with us. We had someone from the National Nutrition Network with us, from Healthway. We had ECU expertise from WAPA, from the arts, from health promotion, and from the early childhood team. And the real product of that was to make sure that we had rippling, concentric, not even concentric perhaps, matching communities where the messages could take feet and grow from. All right, so it wasn't just within the playgroup families themselves, but within all these other people that came together. They were an echo chamber, if you like. They amplified what we were going to do. So in doing this, we then carefully selected our techniques for getting information and sharing information. This is a research project, but more than that, we had to make sure that our methods helped amplify to the people that we wanted to connect with across all these multiple communities. So one of the first things we did was we sent a survey to say, what sorts of arts experience do young children and their families get in our communities? I can tell you not very many, actually. And what sorts of health issues do families want to talk about when they're at playgroup? They were many and plentiful, so we had a lot to choose from. But again, we argued, we debated, and we got there. So what we did at the end was we have made a whole lot of resources together at playgroup, and we're making resources which Caroline will tell you some more about being together on country, eating together, feeling together, moving together, and playing together. So we made some video scripts. We worked with very young teaching artists. Again, we had a script consultant. I'd gone into territory I never thought I would be in. We've come up with amazing resources. We use the playgroups as our filming venues and testing venues. We also use the community development offices that Caroline talked more about. We've finally filmed them, got them in the can, and we've made a website, which Caroline will tell you more about. So that's the start of the project, and I'll let Caroline tell you about the community aspects.
Yeah, it's the other way, Caroline. Go backwards.
Hello, I'm Caroline Ince. I'm the marketing manager at Playgroup WA. So to start with, I'll just explain who Playgroup WA is. We are the peak body for playgroups in Western Australia. We've been establishing and supporting playgroups in Western Australia since 1972, so more than 50 years. And our vision is to see families and children thriving in their local communities. So for anyone who doesn't know, a playgroup is a place, quite simply, where families meet with so it's parents and their young children regularly in their local community, usually once a week. Playgroups are distinct from, say, childcare centres in that the parents stay and play. That has benefits for the parents, that they get to make friends with other parents, and they also get to see and participate in their child playing. They get to see them learning and developing. Playgroups themselves are quite a sustainable model. Most of the playgroups that Playgroup WA supports are called community playgroups, and that means that the people running them are the parents who are going to the playgroup. So it's volunteer based, which makes it more sustainable and more low cost for running the playgroup. Also, the playgroups are often at low or no cost venues in local communities, so they can be supported and even take place in schools or local government buildings, which the local government supports with low or no cost fees, sometimes in church facilities, aged care centres and so forth. So that's the sustainable side. So where Playgroup WA comes into it, we provide support to the playgroups for the running of the playgroup. We support those volunteers, and we like to partner with people such as ECU, on projects to provide evidence-based resources and play ideas for children to help them to grow and develop. For this project, we started with as Annie has explained, working with both the playgroups. So ECU went out to the playgroups and spoke to the parents to find out what they needed. We also have playgroup development officers, that's staff at Playgroup WA, who also provided input into the research to find out what play ideas are going to work in a playgroup setting, because of course we don't have professionals or educators. Some of them are, that happen to be parents who are educators, but many of them are not. So we wanted to make it easy, relatable, something that they can do at playgroup. So that was the research that was done. Now, Playgroup WA also has a great reach, and that's the opportunity of this project. So we have our website, which has thousands or hundreds of thousands of visits every year, and on the website is where these resources will be housed. So that is the arts play activity resources, the links to the videos that Professor Lenny explained, and these are accessible to all the families and the whole early childhood sectors. In addition to that, we will be sending out posters to our member playgroups across Western Australia. And on these posters, there will be QR codes with links back to the website, to the videos, so that they, while they're at playgroup, they can get out their phone and they can watch the video and then do the activities there at playgroup, making it easy for the parents to do. Also, our playgroup development officers can go out on the field and visit the playgroups, and while they're there, they can help to integrate those resources, model what you can do, and integrate them into the activities that they do at playgroup. So there's songs, there's various different things that they can do, dances, other arts-related play activities that have health messages. So the playgroup development officers can sort of explain those. They've been part of the research, they know what they are, and they can explain them to the parents as well. We also have a wide reach on our socials and newsletters. We have 35,000 subscribers to our newsletters. Roughly 12,000 people open our newsletters every month. So we will be promoting these resources in our newsletters. There's 25 different activities, so we will do bite-sized promotions as well as an overarching launch. Speaking of the launch, our launch will be at the Playgroup WA Annual Fun Day, which happens at the Wanneroo Showgrounds on the 25th of November this year. We're expecting about 5,000 attendees. This is an event that we have that's free for families with young children on a weekday during school time. So it's really focused on 0 to 5-year-olds, and there's lots and lots of free activities, and a range of different community organisations attend, as well as paid fun play activities for the kids to do. And it's an opportunity also for parents to find out more information about play and other information that parents need to know in their community, health and so forth. So we'll be launching it there and showing some of the activities at the Annual Fun Day and providing the posters there as well. Another way that we can make this project sustainable is through academic and sector sustainability, such as papers, presentations, blogs, practitioner and family newsletters, social media and magazines. And now we're ready for the Slido questions. So Playgroup WA has been supporting, servicing and establishing playgroups throughout WA since. It is 1972, so 53 years old. And then we're ready for the next question. So what are your ideas to make playgroup sustainable? And as I've said, a playgroup is a place where parents, caregivers and extended family come together each week with their babies and young children, ages 0 to 5, to learn and connect. Okay, thank you.
Yeah. Oh, this one? Yes. It's funny, isn't it? They all seem to be reasonably level in terms of intensity. It's all about resourcing and optimism. Thank you very much for that presentation. What I really love about this is it's a really good example of the value of partnership and co-construction, not only for relevance of putting the program together, but also to maximise your reach. And that's something that we really love to see in applications that come through, is that partnership across relevant target. So thank you very much. Our next speaker is Amanda Derbyshire from the University of Western Australia, and she'll sit with us from the KIDDO program, which is a nationally recognised initiative promoting physical literacy in early childhood and most recently in primary schools. Healthway has been a proud supporter of KIDDO since 2017, so we obviously think it's a good idea. So some insights from Amanda.
Excellent. Thanks, everyone. I'm going to give you a few questions before we even start. So you might be a bit of guesswork because you might not even know what KIDDO is. So the first one, which of the following has not been a major KIDDO's program sustainability? Not. Answer these questions during the presentations. So you're looking, the hard copy resource, 67%. When you're an online platform, hard copy resources, you often find them on the shelf. In a lot of my school visits, you go there and these wonderful hard copy resources are looking really dusty on the shelf. So that certainly hasn't helped us as the sustainability of an online platform. Next question is one of the biggest challenges for KIDDO sustainability. Sorry. So one of the biggest challenges for KIDDO sustainability. So you can see balancing grants with a commercial focus, too much corporate investment, lack of partnerships, and being based outside Australia. And yeah, you've got it. So well done. Balancing grants with a commercial focus. I'll talk about that a bit during our presentation. But certainly a challenge that we continually do, trying to build sustainability by having a commercial funds coming in, but balancing that with delivering grants and also making the program accessible for the people who really need it. So jumping into the presentation and a bit of an introduction. So my name's Amanda Derbyshire, and I'm lucky enough to be the program director of the KIDDO program, which is based in the School of Human Sciences of WA. I've been in this job since the beginning. We started Uni Active. I'll talk you through that a bit. My background is as an exercise scientist, health promotion and research. I'm here on behalf of the team, and particularly on the sustainability side of things. A lot of this has been led, certainly on the ideas side, by Professor Michael Rosen. So I want to acknowledge him today. We often call him the Professor of Inspiration. It's definitely the ideas man. Okay, let's see. Okay, so today I'm going to talk to you a bit about an overview of the KIDDO program, because I know many of you might not be familiar with it. Our journey to date, I could probably speak for a couple of hours on that. And then sustainability from two different aspects, both as a program, how do we keep the program going, but also within the program, how do we get schools and early childhood educational services to continue to use the program? Because sometimes, you know, new and shiny programs, they're really exciting, everyone's keen to get on board. What does that look like 5 years down the track? And how do we keep that front and centre, because we know the benefits are there and the future. I am going to jump pretty quickly. I've got lots to share, but hopefully we'll touch on the key points. So what is KIDDO? KIDDO is a physical literacy program. So our goal is to improve the fundamental movement skills and confidence of all children, particularly 0 to 12 years is our focus, and we work across the early childhood education and care services and primary schools. We started off as a face-to-face program. We quickly switched our focus to building educator capacity, because that's where we can have a real difference. If we can build the capacity of educators who are working with children every day, we can have an impact on those children. We also want to link parents in, and this is something we're definitely still working on. How can we engage families? That learning and development continues at home. It can't just be in the education sector. We aren't a research project, which is a bit weird coming out of a university. We set up very clearly we didn't want to be a research project. We wanted to translate the latest research into community programs that can have an impact. provide them with the latest evidence-based resources. We have built research around the program, so showing it's effective, and that's really key. But the reality is there's a lot of research that's been done that fundamental movement skills are key and the positive impacts they have on children. There isn't really needed for more research on that. We also know interventions work, school interventions work, that if you teach children fundamental movement skills, they will improve. So KIDDO is based around implementing that. Being an online platform, we've got people around the world using KIDDO, so it really has made it accessible to everyone in WA, from Cocos Islands to Esperance and all across Australia as well. We do a fair bit of face-to-face, particularly in WA still, because we're based here, but that's certainly something that's reducing. It's trying to build the online platform and build a national presence. So a bit about our journey. We started in 2014 as Uni Active at Mount Hawthorn Primary School, delivering a before-school paid fundamental movement skill program based on the research around fundamental movement skill interventions. We deliberately started in schools in leafy green suburbs where we knew parents could pay. Sustainability from the outset. We didn't want to be a 3-year program that got a grant and then rolled over. We've all seen that happen a lot. So right from the beginning, our conversations around developing KIDDO, or Uni Active then, was how can we build a program that works? So first we tested it in schools where they had a capacity to pay that wanted it. And we then, in 2017, we went to Healthway and we say, hey, we've got this fundamental movement skill program that works. Now we need to reach the people that really need it. How can we do that? And Healthway have been a huge supporter throughout the program. We've had three-year grants and they've allowed us to really embed the program within Western Australia. So that helped us build an online platform and get to those target audiences. So even today, and it's probably a key success for the KIDDO program, is that our users, our user base, schools who use it, who pay for the program now, are from more disadvantaged communities, are from regional and remote. We're definitely overrepresented. We actually have a lot less of the private schools and schools who probably have more capacity to purchase because of this initial focus. And it was all free at this stage. 2017, we piloted in schools. We then had Good Start Early Learning who came to us and said, hey, we really need something like this. So we developed 0 to 5 years and had that support for educators. There really wasn't much in that sector at that point. We pivoted in becoming an online platform. We engaged with the Australian Sports Commission and they gave us funding to take it to regional and remote. We became part of their Sporting Schools Plus pilot program for physical literacy, which gave us access to schools around Australia. That was a game changer. All of a sudden we had schools in every state and territory using KIDDO. But this was key, 2020, online memberships, bringing that commercial revenue, another form of revenue rather than just grants, and launching our memberships. We started off as individual educator memberships and we quickly changed that to whole of school or whole of service memberships, because to have a real long-lasting sustainable impact, you really need to be working with the whole school. You need to have the leadership on board, and that's been a key learning for us. And it's a key challenge as well, because getting the leadership on board, like you might say, you've been going since 2014. Why aren't you sustainable yet? And, you know, if we'd known the journey we're going on, then we might have packed up our bags right at the beginning, to be honest. It is hard work, but we've learned a lot along the way. And the reason we're not sustainable is physical literacy and fundamental movement skills is not a priority for many. It's our job to help raise that priority level, and we hope we're doing that. But in schools in particular, numeracy and literacy is right up there. And we're trying to build that in, understand how that's so fundamental movement skills is so key, and physical literacy. More recently, we've added year 3 to 6 content, so we're a whole of primary school program. So some of the keys to success, and I'm not going to touch on all of them, but some of the keys is a stable workforce. The fact that I've been there since the beginning and have been able to develop relationships along the way is really key. We have a small but very stable team who've been with us for 3 years now, in terms of a marketing manager and also our primary schools manager. The evidence base, you've got to know that it works and you've got to be able to demonstrate that clearly, and that's been key with engaging with government agencies. We also had a steering committee. So right from the very beginning, we had the Department of Education involved, we had Department of Communities involved, we had what it was Department of Sport and Rec then involved. So right from the beginning, although they've never provided us with funding, they've been engaged and helped us promote the program from the beginning. Having those multiple sources of funding, so not just relying on the grant, is really key. So that commercial revenue funding, most grants you apply for have how are you going to be sustainable is a key question. So we can answer that. We've got a clear goal. We've brought in expertise. So for the last 5 years, we've met weekly or fortnightly with a business advisor. So we're always looking 3 or 4 years in advance. What does KIDDO look like in 3 or 4 years? So bringing in that external expertise that can support us with skills that we don't have, that's probably been one of the biggest keys, is having that helping us with our business modelling and what we need to get to keep going. We don't have all the answers yet. Expanding nationally is also key. We realised probably about 4 or 5 years ago, WA wasn't going to be big enough for us to be sustainable. Our business model shows that we need 800 paid members a year to keep it going. And so we've now got pilot programs happening in the Northern Territory and Tasmania that have been funded by governments there. We have great engagement in Victoria as well, because we've been going to their conferences for a couple of years. So they have paid memberships. So that's really important to us. And if we'd known that at the beginning, the importance of being a national program, we probably would have saved a lot of resources and time. But it's tricky as well. Like, there's many curriculums out there. There is an Australian curriculum, but New South Wales have their own curriculum. Victoria have their own curriculum. So in a small team, it's really challenging to be a national program. So I touched on this, that we have a steering committee that's really representative in Western Australia anyway, of people involved in the space. However, we probably, to get to that national level and really embed it nationally, we really need to broaden our steering committee to have national board as well. And it's tricky trying to get across all the different departments of education across Australia. It's really, there's barriers. One of the most recent barriers we're focusing with the increase in technology-based platforms being used in schools and security concerns. Every state has their own systems that we need to apply for and get approval for, and that's very time-consuming. So lots of challenges. Being a small team, I'm sure many of you who work in not-for-profit and sports are very aware of this. We've always been very guilty of trying to do too much with too little. We're ambitious, though. We won't apologise for that. We want a lot of people to benefit, but making sure you're clear about what you want to achieve is important. And being based within a university, so the university doesn't fund us. We have to find our own funding for the program. They do take their bits of the grants as well. And once you go outside of WA, being linked to University of WA isn't necessarily a positive. It's seen as a WA program. Why should we do that? So it is a challenge in its own right. They certainly have been incredible supporters for us, and we wouldn't have been where we are without being able to be based in the university in the first step. But whether that's the future is a discussion at the moment. So we do have great reach now, like I've talked about. I'm going to skip over that. And it really is making an impact. So what worked? So I was just going to touch on sustainability within the schools and ECEC services, and I'll jump over this pretty quickly. But linking to existing policies and practice is key. We've been a lot more successful with primary schools, and the reason why is because fundamental movement skills is curriculum. Teachers have to deliver it. Okay? We are a physical literacy program, but in schools we push fundamental movement skills because that's the language they're speaking. And then once we've got them in, we talk to them a lot about physical literacy. In the ECEC sector, it's been a lot more challenging. Physical activity gets a small mention in the national quality standards. And so not being in those policies and practices is something they have to report about. It's a lot more challenging to get it. We've tried to engage leadership, have a real focus on that. And for schools, data has been key. So giving them data to show the program's making an impact, to see how they're going, to intervene with children who really need it. Schools haven't had data in this area, so giving assessment tools they can use has been a really positive for them. Making sure that others have said continuing to evolve to meet needs. Certainly what we set out to do, it's evolved significantly along the way, and we continue to improve and we continue to seek feedback. I often say to schools, they really have developed the program with us. We listen to them, all their questions, their feedback. We're continually running pilot programs and getting detailed feedback, and they help us develop. It really is owned by the WA schools and educators around. So what worked? Conferences, workshops, webinars, staying in front of everyone, making sure we've got continual offerings to remind them that KIDDO's there as a resource for them. giving it away for free. Okay, we call it scholarships, and this is with Healthway support. We offer Healthway scholarships to maybe regional and remote schools or schools in certain areas that wouldn't access it otherwise. By getting them started with scholarships, seeing the benefits it brings to their schools or ECEC services, they're then a lot more likely to be able to invest in it with school funds. That's been a really successful strategy that we've done alongside Healthway, having champions within the service to promote it, to keep it front of mind. And one of the more recent things we've done is we've just launched our first Physical Literacy Week. And this is specifically at this stage for the ECEC sector. They often have days and weeks. We've had 500 ECEC services sign up to be part of Physical Literacy Week. It's a great way for them to share it with families. Families love that their services are using KIDDO and doing physical literacy. At that stage when your children are young, you know it's important. So it's a positive for services. Lots of different things that we've tried along the way. So some of our less successful. We're still working on a lot of these. We've tried a franchise and a license model. We actually have GIP Sport in Victoria who use the KIDDO program. They have their own KIDDO Gippsland website, and they're actually very successful, but we quickly figured out that probably wasn't the route we wanted to go down. Trying to be everything for everyone. In the beginning, we had a coach section, a primary school section, a section, a home section, narrowing our focus to primary schools and ECEC services. Going through them to parents has been key. We're still working on the parent engagement. With STEM being very big, we developed an active STEAM program. There's a few, and like I said at the beginning, hard copy resources as well. That's something we've gone away from since the beginning. So the future, everything really comes back for us in trying to achieve our mission of helping all children develop the skills and confidence to be active. We're having a lot of discussions at the moment about whether we become a not-for-profit and a charity, whether that helps our future funding. We're continuing to build that commercial revenue stream so that we don't have to rely on 3-year grant funding cycles, and that's really key for us. But it's a work in process. Like, I feel like we're a startup, but we've been going 11 years. So thank you for coming along today and listening to our story.
Thanks, Amanda. A lot of good learnings there. They're good and they're bad. Well, not bad, but fantastic. And I really appreciated your focus on the diversity of funding as well. Multiple funders is not only a good way to get more funding, but it's also a good risk management approach as well. As you know, in government policies change, so we really do need to diversify. So that if you're not organisation to fund you, then you're not going to find out the next day it's changed and you're pretty stuck. But what's been really good with KIDDO is that focus on looking at different funding models, including commercial, because that's where you get your sustain. So fantastic. Thank you very much, Amanda. Our final speaker is Fabian Ross, who is the CEO of Basketball WA. And he'll provide insights on sustainability in the sporting sector, drawing on his experiences, including his previous position as the CEO of Hockey WA. So we've had a long relationship with Fabian and looking forward to his insights on sustainability in sport.
Thanks very much, and thank you for having me this morning. Really looking forward to it. I think before sport, my background is was running sort of corporate environments in wealth management, superannuation funds. So coming across the sport 3 years ago was quite interesting. Probably learned two big things. One is that I definitely underestimated how political and emotional sport can be. Is the funding sources and really the resource constraints in not just sporting organisations but in arts and culture and not for profit. So so really trying to unearth and change that environment is really, really important. I'm going to start with a couple of Slido questions as well, and the first one's already up there. So how many sporting organisations have Healthway supported in 24-25? And I'll give you the answer. The answer is actually 63. So if you consider how many sporting organisations are in the landscape, it's well over 200. Just think about the opportunity set there in terms of the fact that we're only at 63. And I think the second question is, how can sport-based programs better support Healthway's health promotion goals? And I'll let you go through all of those. It's not a trick question, this one. That's right. It's actually all of them. Really important to understand that there's so many different ways to help and support. Hey. There we go. I thought really important to start firstly in terms of the current environment and set the scene and give a bit of context. I think it's really important to start there. So like all businesses, sport, let's face it, sport is a business now. We live in a very complex and changing world. And so from that perspective, it's important to think differently and think with an agile mindset, not just a fixed mindset. And there are a lot of moving parts to a business model, particularly as businesses change cycles. But I just wanted to highlight and touch on a couple. The first being revenue. And traditionally in sport, the revenue profile or the funding sources come from two. One is government and the second is membership fees. And if you consider the world today, membership fees, we're going through a cost of living crisis. So how do we actually increase fees in that environment? And what percentage can you increase fees? Even going at CPI is a really tough ask against the market at the moment. So that's one thing to consider. And the second is obviously funding from government. And as we all know, depending on the cycle of government, that has a very, very big impact in terms of the pool of money available to different organisations. So there's two sources. So from a business and a sporting perspective, it's really important to start to consider what is the shift and how do we shift the dynamics and shift the dial in terms of driving that long-term financial sustainability, and funding sources is one of those. The second thing to touch on is that sport operates in a very saturated market. So consider the pool of money in the market across all the businesses, and you're looking to partner and find sponsors. It's just not sporting organisations, so they're not for profits. It's art, culture, it's arts. So the market is saturated in basketball, as an example, one sport going after all of those clients. So in order to actually pick up your share of wallet, it's important that you have to have a competitive advantage, and that's where Healthway come in. They really do help us with providing that competitive advantage into market. Look at the niche opportunities within the context of that area. There's only two businesses that ever succeed. You're either at scale or you're either niche. So you just think football, or if you're a cricket, you're at the scale end. You've got a much better chance of succeeding. If you're at the other end of the market, you can't compete with scale. You need to be niche. So really need to consider that. So why partner with Healthway? Well, for me, I've got up there, obviously shared mission, clear engagement. They really solidify the purpose and provide a strong direction. But for me, it's the alignment of the values and the mission, and it's about a healthy lifestyle, inclusion, community wellbeing. So it's bringing all of those things together, which helps provide a narrative into market, which is really, really important from our perspective. And it provides clear messaging. And the best example I can give of that is in our junior programs, where the ability for us to segment the market, and if you segment at junior levels, you can really start the process at an education point, but you're not just touching the junior membership base, you're touching all of the people that surround the junior membership base. So the market becomes extended and wider than traditionally is there. So Healthway is much more than just a sponsor. They're a corporate partner. They're part of your strategy as you go forward. And so it's really important that you understand why and what is the opportunity to partner with a Healthway. And what's the benefit? Well, we've seen direct benefit in terms of a number of different areas with partnering with Healthway, particularly in changing habits of youth and families. That's been a really important one for us. And to put that in perspective, we've reached over 100,000 people within the remit of basketball alone, and not just players, parents, spectators, other family members, and importantly, have been able to touch over 50 locations as well. So the extent is significant in terms of how we go about things. We've activated a number of things like Basketball's Fueling Champions, which promotes healthy lifestyle and living. We've got our nutrition-focused activations, which really focuses on hydration and healthy eating. And our Fuel to Go and Play initiatives are really important for our elite sports people because it provides education, but also gets them to understand how important it is to eat healthy to perform at your best as well. So those are just some of the things. And I think what we're really proud of is the fact that we're now starting to activate the right messages into the Indigenous communities and people with disabilities as well. So the takeaway point around the benefits is really the fact that you can actually segment the market, you can get reach into a variety of different areas, but you can really do one-to-many rather than one-to-one as well. So it's really important from that perspective. And I guess the opportunities that it's unlocked. So for us, importantly, it's unlocked numerous opportunities through access to schools, importantly, local governments, health networks, and it's reached far more than we ever would have thought in terms of when we started to set the strategy at hockey, and obviously taking that into the basketball environment as well. It's strengthened our identity, which is really important. So our identity in community is around community first and health driven. And so that allows us to make sure that we're really strong in terms of delivering that message into market. So really important. And if I bring it right back to what I said at the start, it's allowed us to get a real competitive advantage in the market. Whereas perhaps before we were trying to be everything to everyone, now we're able to really hone in on a niche opportunity. And it's real. I think it's real, but it's also really hard because when you've got a KFC or a McDonald's or an alcohol beverage provider coming to you and saying, hey, we can give you this to do this, it's pretty easy to say yes, right? But I challenge all sports to think a little bit differently and to remember that we just don't have an obligation to raise the revenue. We also have a social obligation as well. So if we think differently, we can get benefit rather than just thinking about the financial outcome. And that's really important. And two examples I can give you. Unfortunately, I can't give you the detail that sits behind it because obviously it's commercial in confidence. But two examples that we work with at hockey when I left it, we were able to align our values and build out a proposition that worked for those two organisations was Bravo Apples and IGA Tupper Fresh. So it shows directly how you can work with organisations where your values aligned and great benefits, not just for the sport, but for that organisation as well. I was going to do a little bit more information around that, but commercial and confidence I can't. But what I am going to share with you is just a little framework, which if you get on LinkedIn and link in with me, I'll give it to you in a bit more detail. But think about a triangle and think about how you connect. It can't just be with the organisation, the sporting organisation, and the end user. So in terms of the organisation you're working with, it has to be a triangle. It has to be all points of the triangle. So it's a sporting organisation, it's the organisation like a Bravo Apples, but it's also Healthway. They have to be part of the facilitation of the proposition. If they're not, you don't get great alignment and you don't get great outcomes. So think of it that way. And the framework to use is really, it's what's the purpose? So why are you doing what you're doing? Make sure you really understand that and you focus in on that. What are the partnership objectives? So promotion of healthy eating, is it community engagement? Is it co-branding opportunities? What's the value proposition? And not just from your perspective, what's the value proposition for the sporting organisation, for Bravo Apples in this case, and for Healthway as well? All three have to be captured. So as an example for hockey, expand the health identity. For Bravo Apples, brand association with health and sport, very important from their perspective. And for Healthway, it's about amplifying the health promotion. Then it's about activating the strategy. So is it signage? Is it messaging? Is it campaign and events? And then making sure you're clear on partner roles and responsibilities. And like with every good strategy, make sure you measure the outcomes, because then you can use those measurements conversations with reviews and pivot if required. And then obviously that helps you with renewing your partnership and your strategy. And then I guess the last couple of things I want to leave you with is, whilst that's a direct opportunity to market, there's also the indirect opportunity, because if you think about the bigger end of town, they all have SRI in their scorecards now, so social return on investment. Don't just go after organisations that are purely focused on financial investment or return on investment. Focus on the SRI as well. And if you do that, it gives you your best opportunity to actually get them to come on board with you in terms of future opportunities. So just remember as well. So 3 key messages. Revenue provides long-term financial sustainability. Strategic partnerships with Healthway really create a competitive advantage. And health is a focus, it really focuses and drives real impact in the community as well.
Good tips there. I think Fabian did a really good job of that. But I do appreciate the focus on the value proposition piece. Isn't just about us getting the health promotion opportunity and the organisation getting the funding. There's a hell of a lot of other value packed in there as well in terms of that competitive advantage. And also a very interesting point about considering potential sponsors in their SRIs, which we probably don't think about. But thank you very much. Could I invite our fabulous panellists to just really, but in the front. Too softly, apparently. Yeah.
Thanks, guys.
So, if you haven't already, now's your chance to questions or to upvote those questions you. While we we've got quite a few already, but while we're waiting, I would just like to ask the panelists to just briefly nominate what your biggest challenges have been in terms of sustainability of your programs.
So I think people will immediately say funding, but I think it's working in schools for so long, particularly in schools. It's like, I guess what people said, there are so many, how school was 20 years ago to how it is now. There is so much external pressure on these settings. They've got to be everything to everyone. And so I think we're operating in a lot of noise and, an extremely stressed workforce. And so that probably for me is what I've seen change in that time. Funding has always been a problem. Partnerships has always been a problem. But I think now we've got, the context here in WA is probably a little bit different, but our schools in New South Wales have been through floods, fires, floods again, COVID. There is so much going on that trying to say, hey, pick us can be a challenge.
Yeah, I think you're right. Funding is definitely the one, but I think if I could one outside of funding, it's probably messaging. And I think where we get messaging wrong a lot of the times is that we just have a blanket message. And I think it's really important to understand the segments, context of the segments, and understand what they need, what their needs are, and then so making sure that the messaging is targeted into each one of those segments. So I think it's really, really important.
I think the thing that we talk about constantly is how is it accessible for everyone? So that conversation about the price point and accessible, the price point for sustainability, but the price point for those who being able to can access it. We discuss this when we've tried a few different models and we don't have the answer, but it's forms the focus of many of our conversations.
Okay, for playgroups, I think finding volunteers is increasingly more difficult, especially as people are returning to work and just a bit more time poor. Also, access to suitable buildings as communities grow, and in Perth we expand. The new communities don't always have facilities to host a playgroup, so that's one of the challenges as well.
So we're still doing our project. So I have to suggest that for us in a co-constructive model with many stakeholders, it's taking everyone with us. If we wanted to build this echo chamber by what we're doing, while we're doing it rather than at the end. It's taking everyone with us. And I also have to thank Healthway with Shane and Caroline who've been working with us. We have a large group of stakeholders who all have a different message, different want and desire within the project. And it's got many moving parts. So for us, sustainability is about amplifying, taking with, and creating safe spaces for everyone to be heard and respected.
This will take a while.
One of the questions that got a lot of upvotes, and it's the elephant in the room. So, panelists, are many programs inherently not sustainable? Is that the reality for health promotion? Anyone like to answer that?
I guess it depends on what the definition of sustainability is. I mean, if an organisation is prepared to support it forever, then yes, any program can be sustainable. If we're talking about that, once funding ends or active support ends, then I think yes, inherently a lot of programs aren't sustainable because they're too complex or costly. In terms of understanding them, which is you need to think about what are the determinants of sustainability. So identifying what the barriers are to sustaining it, and then addressing those either in the design of the innovation or the implementation strategies that you use.
Not sure I can add much more to that. I think it was really well said. I think it's not about the financial sustainability. I think it's about the organisation and the want and the desire to actually deliver an outcome. And the want and desire is there, you'll always find a way. So it's important to recognise.
Yeah, I think for us, my goal within the program has not necessarily been to sell memberships, but for governments to recognise the benefit of the program and provide access for everyone. And that's certainly something that we continue to work with the government stakeholders, particularly the Sports Commission. And so it's the way you look at sustainability. Is it sustainable if we just rely on schools purchasing memberships? It might not be. I think there needs to be we're always going to need to rely a little bit on grant funding. There's development, future development and testing and getting to those audiences that really need it, but it needs to be a mix. It needs to be the government engagement, the funding sources plus commercial.
Yeah, I think just continuously building relationships and raising awareness, multiple different partnerships, and also making it easier to run a playgroup with resources and support.
What they said. But I think, because I'm not in health promotion, but I would suggest that for us in our project, it's very much around doing with rather doing to. And again, I'm coming back to this amplification. We've listened, we've asked, and we've heard, and we've created something that we think we know that people have asked for. So we haven't done to, we've done with. I think that's a really important underpinning.
I'm going to stay down here because the next question is the group speakers. When you're looking at the planning stage, for example, what have you learnt about successful co-construction, and do you have any tips on true partnership and collaboration?
Yes. One of our goals was to create a model of co-construction, which we're just doing. So we'll finish that and we will send that to everybody. Sorry. It's relational. It's hugely relational. It is about getting the right people at the table, and that's not always an easy mix to do. So do I have tips? Plan it really, really carefully. Ask a lot of people. Our understanding is that many heads are better than one or two, and I think and build diversity across the steering group, which is what I think we've done, Caroline. And as again, co-construction can only work if there's trust, respect, spaces that people feel culturally safe. Not easy to do. As I say, construction is really easy to say and not easy to do.
Second that really, but it's been a really interesting process to go through, and the planning meetings that we've had with so many different voices and hearing all the different opinions on health and arts and education, and then us from Playgroup It's been a really interesting project to be a part of, to just see the different voices and then seeing it all come together into a product.
But it has to be planned.
It does have to be planned and yeah, pulled together. Yeah.
It's not just get everyone in the room.
No.
Question is in relation to KIDDO. The question is, do you think the KIDDO program is more sustainable because it's not a research program? Should have walked all the way back.
Yes. The fact that we set it up as a program to start with an independent revenue source, and it was, in schools, practical, it wasn't research, and building that research around it. It's certainly the opposite to way you'd see programs developed normally in a university, is that they build the research base and then they pilot the program. So I think the way we've approached it, yes, it's definitely still has challenges though. We're continually looking for the way forward. We've had lots of conversations in the last few years with investors, whether they're interested in investing in the program or whether the not-for-profit path and things like that. So it's not necessarily, doesn't necessarily make it easier, but I was talking to Nicole before, and University of Newcastle has the Dads and Daughters program, which is successful and seeing it rolled out across Australia in different sports. And that's an example of a research project that has then developed into a program that's making an impact. So there's plenty of examples of research projects that have gone that way. I guess not being a research project makes the process a lot quicker though. Research takes a lot of time, a lot of energy, and we continue to apply for research grants and build it. So, but not being a research project, I guess, allows us to build both aims. So putting the program out there in the community and having an immediate impact while building the research.
Thank you. Here's a challenging one for everyone. It would be great if you could all answer this one. So, in your view, what makes a health promotion initiative truly sustainable? Is it translation to government policy, legislation, etc., ongoing funding, community ownership, or something else?
Who wants to start?
Who wants to go first?
I don't mind.
I guess I'll speak from a sporting organisation lens. I think, as I said, it needs to be sustainable from a funding perspective. I think the one thing is getting boards to understand how important this lens on the community is, because unfortunately boards look at the P&L all the time and the balance sheet. I think beyond that from a financial perspective. But I think importantly, what makes it successful is connection with community and making sure, and not every community is the same. So when you're dealing with someone up in the Pilbara or up in the Kimberley, it's very different to the metropolitan area. So making sure that you're building programs that are directly impacting those communities is extremely important, because that's the only way that you'll get sustainability in whatever form that you want it to be successful.
Yep. So it's, we've been looking at different clinical and community-based initiatives, and it's the things that, and you probably know these things, that people just say, this is just what we do. Like crunch and sit, you will have now generations, children who were exposed to crunch and sit and now parents, and they're like, that's just what we do. No hat, no play is probably another initiative in schools where it's just become so ingrained in an organisation. And so I think one of the things we're really interested in is there's lots of bad programs, there's lots of bad practices that happen in clinical and community settings, but they still exist. And so unpack of, despite there being no funding, no leadership support for it, actually being told don't do this, it is just ingrained in what they do. And so I think, is it policy? Is it history? Is it a generational thing? I guess there's probably lots of reasons why something just sticks, and our research is understanding what makes something stick and others not.
Yeah, look, I think it's really important to look at the sustainability as more than just a program continuing. Because if you think about it, in 20 years' time, someone who, I'm going to talk from KIDDO's perspective, someone who's completed our training, regardless if kiddo still exists, they might still be teaching kids muscle arm and some of those benefits that they've learned are sustainable, and that's still having an impact on the children of today. And so looking at those benefits, just because a program doesn't necessarily exist for 20 years or 30 years, it doesn't mean that the impact and the benefits aren't ongoing and continuing. So I think it's really important to take that into consideration as well. It's not necessarily judging a program, it's looking at the actual impact it has on the community.
I'd say community ownership would be our number one focus for playgroups, particularly because they are run by the families, and without the families, they don't exist. So Playgroup WA's biggest partner is our families. However, with the ongoing challenges of families being so busy and the cost of living and everything else, without government support to help us to let the families know that playgroups exist and the benefits, including health benefits of attending a playgroup and all the social and play benefits that come from that, it can't be sustainable. So I think community ownership first, but then without the government support, it can't happen.
I'm going to take a bit of a different take. I think it's co-developing messages that stick for health promotion for us. And again, I've learned, I'm new to health promotion. I'm learning a lot as I go. But, it's slip, slop, slap, crunch and sit. They're messages that stick. They're messages that families talk about when they get together. And I think that's what we've tried to create. So together at Playgroup, we've very much looked at both mainly the population are younger mothers generally with children 2 and under. So we've really gone for mental health, both for children and for families. So together at Playgroup with the messages that we've got 5 messages under that banner that we're hoping will stick. So they're made locally, they're tested locally, and we're going to expand them, not just in the state but nationally. And I think that's really important.
Goodness me, we need more than one. This question is for Fabian. You've touched a lot on commercial thinking. So how important is business thinking in building sustainability programs?
Question. I think it's very important. From my perspective, strategy always comes first. If you think about organisations that are successful build strategy that are actually executable, and if you build strategy that isn't executable, then it just never happens. So business thinking is really important from the perspective of right back at the core, understanding what your members or your consumer or whatever business you're running, you must understand what their needs and wants are. If you don't understand that, you cannot build out a business proposition or a business strategy. So that's the most important thinking. And I think thinking commercially, I use the terminology VUCA a lot, which is we live in a volatile, uncertain, complex and ambiguous environment. And if you think about successful businesses, they're always thinking about that don't set and forget strategy. They're always focused on pivoting strategy almost on a daily basis, understanding, getting the insights or getting the data, build the insights, respond. So for me, extremely important. And that's the way that I'm trying to get sporting organisations to think now as well.
All right. Nicole, could I ask you this one? A lot of panel members of programs built around well-established systems, like school, etc., where community is often. How do we sustain programs with communities that are not engaged with?
So I get about obviously co-design. One of the things that I kind of mentioned before is like thinking about the determinants or the barriers to sustaining any initiative. There are some really great tools. 2 tools that come to mind are developed by Doug Luke and his team. One's called the PSAT, or the Program Sustainability Assessment Tool, or the CSAT, the Clinical Sustainability Assessment Tool. And they're really short item tools that you could actually use with your partners. And it gets you to kind of go through the key areas that have been identified to put a program at risk. I really like these programs because it opens the conversation in terms of what are the things that we need as a group to think about if we're going to sustain this initiative. And quite often, we always think it's going to come down to funding, but it isn't always. It could be that we need leadership support, or we need that champion in the community to do it, or we actually need, transport or something. Like there are other things that often emerge that isn't just fun. So I think, especially when we're working with our vulnerable communities, using these kind of tools to have the conversations to really dig into what will make this program sustain or not, and then selecting strategies around.
Beautiful, thank you. We've only got a few minutes left, so what I will ask the panelists is, this will possibly revisit some of the comments you've made, but if you could leave us with one specific nugget about sustainability in health promotion programs, what would it be?
Right. Thank you, Tom.
I think I have to agree with Fabian. He calls it strategy. We call it planning. I think you have to be really have together what your core message is going to be, and how then you can, I'll keep using the word amplify, ripple, how you can send those roots out and make sure that those roots in the community are strong and structured. That doesn't happen by chance. It's really carefully coordinated and thought at the very beginning of the project, not at the end.
I agree. Strategy and planning is super important. And I'd say clarity and collaboration as well. So if you're really clear on what you want to say it really clearly, and then collaborate to get that message spreading out through the whole community.
Yeah, very similar as well. Thinking beyond the 3-year grant funding cycle. So right from the outset in the development stage, thinking what we want to achieve at 1 year, 3 years, 4 years, 5 years, and bringing in that outside expertise. So have that expertise in business. That's been the biggest game changer for us. It's regular meetings with someone who's well versed in business and helps us with that business modelling, planning. It's the number one thing that's made the real difference for KIDDO.
I'll probably just say something a bit different because they're all absolutely legitimately 100% right. But I think the other thing to think about is don't be afraid. So you've got to try stuff, right? And if you don't try stuff, well, you don't know if it's going to work or not going to work. So don't be afraid, but fail fast. So make sure you have a base where you can actually very critically say, no, that's not the right path for these reasons. Go again. So, but don't be afraid to fail.
And mine's probably a combination of those. The quote that was coming to mind is, if you plan to fail, you fail to plan. And so, yes, thinking from the get-go, who's going to own this? And if it's not me, then how am I going to get that organisation or that agency to take on? Lots of people, if you're an agent, they will come knocking saying, pick my program, pick my program. If people can't demonstrate that it can be implemented at scale and sustained, say no, thank you. You'd rather you pick the less effective innovation that has been demonstrated it can be scaled and sustained if you can't support it.
Perfect, thank you. I couldn't have written it all better myself. Thank you, panelists.
Thank you.
What a thoughtful and engaging discussion, and some really good, we've gotten from very different perspectives across our health promotion family. There were a lot of other questions here that we haven't got time to get to, but as always, if you have any questions or you'd like to run some questions past us, our partnership team are ready, willing and able, very enthusiastic, and they'll help you by giving you feedback, helping refine ideas. And going back to what Fabian said, we are looking for new and better ways to get that message out there and to achieve that health impact. So if you have something new and different in mind, please come and talk to us. We are, as always, completely evidence-based. We want to make sure that the data's right to support what it is we're funding. but we are also here to help you explore new ways to which we're all trying to do. So please do talk to our team. We're very enthusiastic and we're happy to hear new ideas. So I've gone completely off script. Everyone's like, get back on. So thank you again. We have a morning tea to our right, so please stick around to continue those fantastic conversations. And before doing that, I'm getting an eagle eye here that I've forgotten to do something, which is to remind you that Healthway's Research Assessment Committee is looking for nominations, and this is a fantastic and very important function in Healthway, and I encourage you to have a look at putting your name if you're interested in participating in our research assessment process. Very important, and we really welcome the engagement of the research community in those assessments. Let me just double check with me. That's all I have to say. So you would like to give us some feedback, we'd really appreciate that. And please feel free to visit Healthway's website to stay with us. We're constantly sharing insights through our e-newsletter, so please subscribe to that. And once again, thank you very, very much to our wonderful panelists who gave us so much to think about today. Thank you very much.
Oh, thank you. Julia comes. Yeah, thank you. Like, you, Shana. Thank you.